Hello, Dr. Markle of Centeno-Schultz Clinic, and today we're talking about lumbar spine disc injuries. And today's presentation is mainly for those individuals that want to know, are there alternatives to things like corticosteroid epidurals, or have been told they need a lumbar spine discectomy or a different invasive surgery. So this procedure or this presentation is basically looking at alternative treatments to those for lumbar disc injuries. Now let's talk about the lumbar disc themselves. The disc goes a collagen matrix that composed of two different areas. In the middle, we have our nucleus. So we have our nucleus right there, and on the outer rim of it, it's dense fibers called your annulus. We'll put an A there for annulus. In things, when it does get injury, though, that annulus tends to get torn, degenerated, weaker, allowing some of the disc material, the nucleus, to exit posteriorly or to go all the way around where the nerves exist. Now, these symptoms can, a lot of people exist with no back pain at all, no leg pain, and even though they have an annular tear, it may just be there without being symptomatic, and some people actually do create some symptoms because of this. Now, those symptoms can vary in what patients feel. So if that disc material starts leaking around the nerves, as it is here, it can start irritating the nerve, creating leg pain, or a doctor term that's called radiculopathy, quote unquote sciatica. It can also just irritate the nerves locally and create some low back pain. It can cause the muscle spasms, or also get referred into your lower glutes in the back part of your pelvic bone, creating also pain. Sitting tends to be an aggravating position, meaning if someone sits for a few minutes, the pain starts increasing, meaning sitting puts the most pressure on the disc. If there's a hole in the back of the disc, it squirts the nucleus out of the disc around the nerves, increasing someone's back pain. So someone's typically, if we're thinking about treating someone's disc, they're typically have these symptoms that are aggravated with sitting. We call it sitting intolerance. So traditionally, medicine has had a few treatment options for this. One would be physical therapy. So physical therapy working on strengthening the muscles around it, better body positioning to sort of help everything around it, so it takes some stress off of the disc. And sometimes that's all patients need to do. If pain continues, then we're talking about corticosteroid epidurals, where interventional physician puts a needle directly around where the discs and nerves are and inject a typical corticosteroid epidural, high-dose steroid, to shut down any inflammatory processes, and that can also give some patients pain relief. Bad part about a steroid epidural, long-term wise, that it can actually cause detrimental degeneration to the disc, degeneration to the nerves and joints around it, and somewhat toxic to it. That's why physicians typically limit you to several injections a year and don't really recommend doing anything more than that. And there's been lots of studies looking at steroids in joints, cartilage, nerves, and it's very toxic to those areas. And that's the reason why your physician typically only allows you to do a certain number of those injections a year. And then worst case scenario, some patients are told they need a discectomy, where they do a surgery and go in and actually clip and remove part of the disc. Now, long-term wise, that's actually weakening the disc, and it sometimes can be a pretty painful recovery period for that, and puts you at risk for disc degeneration or any worsening arthritis around that area. And ultimately, if the discectomy doesn't work, the steroids don't work, physical therapy hasn't worked, a lot of physicians, spine surgeons at that point recommend taking the disc completely out, putting a spacer in there, which would be this guy, and then fusing it with these lag bolts. Now, long-term wise, that is also can be effective for if a disc is painful, causing pain, debilitating pain, but long-term wise consequences of that are real, where they create what's called adjacent segment disease. I mean, if they fuse that, well, that's just going to distribute this force over that level above and below it. And then those areas start degenerating and causing some pain eventually. Now, all these treatment options long-term wise haven't been that effective, looking at some literature in the United States over the last 50 years. Failed back syndrome is essentially someone that's had surgery and still continues to have pain, debilitation. If we look at the surgical fusion rates, have dramatically increased over the last 20 years, where previously 70,000, now over 200,000 spine fusions are being performed every year. And that atones to the fact that all those other treatment options, steroids, discectomies, as well as physical therapy, sometimes aren't doing the job. And with that, we have about 50% of spinal surgeries are successful. So spinal surgery itself is about 50-50. And then if you need subsequent surgeries after that, the success rate dramatically reduces about 50% every time. And then this is extremely costly for the United States as a whole, $16 billion direct costs from spinal surgery, not including complications, not including time out of work, as well as some downhill debilitation from the patient, lost wages and whatnot. So here at Centeno-Schultz Clinic, we're working on alternatives to steroid epidurals, lumbar fusions. We start with simple platelet procedure called a platelet lysate epidural, where we're able to place growth factors around the disc and around the nerves to try to stimulate the body's regenerate healing capabilities, help the nerve regenerate, help the disc heal. And we've done this over the last 15 years with quite success. And this is a publication of ours showing long-term wise success rates right around that 70 to 80% over about approximately 2 years, as comparison to steroid epidurals, which are toxic and only give you less long-term symptomatic relief. So it's a better alternative, it's healthier for you, and we've been shown in literature that this is something that can give longer relief as comparison to steroid epidurals. And then if an alternative to even that is going directly into the disc tear with what's called platelet-rich plasma. The platelet-rich plasma has been shown to be very effective with a level 1 randomized control, placebo-blinded research study showing we've got about 70% success rate, and sometimes even higher doses of PRP can be up more of like 80% success rates. Long-term wise, the longest follow-up is about 9-year follow-up. So that's also a great alternative. We typically don't start with something like that unless we have to, but going into the disc does pose risks as well, such as discitis, which is an infection in your disc, and or you can degenerate the disc faster given the fact that you're poking a hole in it with the needle. Now, we've minimized those complications and consequences of the procedure over the last 15 years, where we rarely see those complications. And this is just some highlights of patients we've treated. The red circles are the annular tears. So we have an annular tear right there, and that can leak directly onto the nerves, which exist right here. And if we look at after treatment, the tear itself has healed on both parts of it, and the patient no longer gets any back pain or sciatica. Same thing in the bottom one. We have a pretty bright annular tear. After treatment, putting platelets into the tear, we can see regeneration and healing of the tear within a matter of months. And ultimately, the best stem cell injection you can do is a culture expanded mesenchymal stem cell injection that we've pioneered and do outside the country, and have also studied this as well. For the right patient, we can take your stem cells. It's not approved here in the United States, but it's something we do at our Grand Cayman location. And we've also shown great success with that over the last 15 years, showing reduction of the disc bulge as well as healing of the annular tears. So spine treatments, not one single spine treatment is right for everybody. So this is something we're happy to examine you and evaluate you to see what type of spine treatment would be the best approach for you. Because if you have just degenerative discs, a herniated disc, a torn disc irritating a nerve, or just nerve irritation, all those requires different specific treatments just for you. So if we can do something like a platelet lysate procedure, and then we're targeting multiple areas around the disc. This sort of help everything: joints, nerves, discs, ligaments, If it's a nerve herniation, sometimes we actually, again, just do the epidural, or we can go directly into the disc. On rare occasions, we'll do a bone marrow concentrate injection, which does have some stem cells in it, and go directly into the disc as well if someone has a very large tear. And ultimately, if someone has a large bulge and they failed all conservative treatments, don't want surgery, a culture expanded treatment could potentially be right for you. So as I said, my name is Dr. Markle, regenerative medicine expert here at Centeno-Schultz Clinic. And if you've been dealing with any of these spine issues, we're happy to give us a call, and we're happy to evaluate you and figure out what's the best treatment option for you. If you have any questions, concerns, feel free to reach out to any of our social media outlets. And thank you. Have a good day.